Meet Michele Bell with Coordinated Care Solutions, LLC.
Well, first of all, thank you, Angie, for the opportunity. I definitely appreciate it. I founded a business called Coordinated Care Solutions, LLC, and we are a care coordination and patient advocacy business. We offer personalized assistance to our clients in navigating the healthcare system. So it could be something as simple as scheduling appointments for someone who may be busy, assisting a parent who may have a college student here in this area and the parent may live out of state, helping someone coordinate care after surgery, or even something as simple as arranging private rideshare.
We've known each other for a very long time. We met when our daughters danced together, and we've been friends ever since. They would dance
over
together.
20 years, 22 years, I believe.
22 years.
Mm-hmm.
And so one thing that I know for a fact is that Michele is a stand-up person. She's awesome. She's amazing. She's loyal. Anything she puts her mind to turns to gold. I'm extremely proud of you. And so I remember whenever I would call you, your voicemail would say something to the effect of, "This is Dr. Stark's office." But it doesn't say that anymore. So tell us why it doesn't say that anymore, and where are you on your journey?
Ooh, okay. So, yes, my voicemail no longer says Dr. Stark's office. Dr. Stark actually retired in 2022. And a practice bought his practice, and I ended up staying, and I stayed for a year. And after that, I realized, I think it's time to make the next move. Not really knowing where I was going with it, it kind of clicked one day. What did I do, and what did I think I'd do well for follow-up appointments? So I actually have a client I'm working with now who is transitioning from one primary care to another. So what I'm doing is helping her find a new physician, someone who meets her needs. We do promise to build strong relationships with the client so that if ever, they need us again, we know who they are, and we just try to pick up where we left off. Some clients may just need to have a short-term need, whereas others may need long-term. So again, it's all customized to what's needed. You may just need, hey, I'm looking for ear, nose, and throat doctor. I keep having recurrent sore throats. I've seen my primary. They want me to see someone. Can you help me out? So I can help in that way. Another client I had needed to have an EMG and a nerve conduction study for numbness in the hand, and he did not want to continue going into DC. He wanted to find someone closer to home. So I called around, I asked for referrals of who they used, and I actually contacted an office, went into the office to check it out myself, met with the practice manager, found out that the doctor wasn't accepting clients until July, and I got him an appointment for March 13th. So, just with my over 35 years of experience in healthcare administration, I kind of know how to ask the right questions, kind of say the right things. And it's not that when someone calls an office and says, and they're told that they can't get in for 3 months, I don't have a way, I don't have any secrets to that. It's all just in how you present it. It's not that they're giving me preference. It's all in how you present the client's needs.
I really like that, because we are too busy. We let things go. What is the impact of just ignoring symptoms because we're too busy, or we don't know who to reach out to?
Okay, I hear your question, but I'm going to take it and turn it a different route. Mm-hmm. Even if you do not have symptoms, ignoring just your routine healthcare can lead, to something later on. For example, not getting your mammogram, not getting your colonoscopy, not realizing that 45 is the new 50 when it comes to the colonoscopy, especially for Black women or Black men. You have to start early. Your annual exams, understanding what your baseline labs are. Your baseline may not be in the range of a normal baseline, right? So if you don't know this, and you end up with some sort of an illness, you won't realize, oh, that's my baseline. Or even your blood pressure. Everyone's blood pressure isn't always 120/80. So knowing your baseline, knowing your numbers, I think is the main start of taking care of your health. Knowing how often to follow up with your doctor, having a primary care physician. A lot of people use urgent care and the emergency room as their primary care physician. So I really am striving to make sure that everyone I know has a primary doctor, follows up on those routine appointments, and like you mentioned, don't ignore those symptoms. A lot of times it's not anything major, but we're afraid. You know, we are afraid. We are afraid of what can happen to us, you know, if we go to the doctor, if we go into the hospital. But again, that's why it's always important to have an advocate, whether it's a friend or a family member or someone like me. As a matter of fact, I had a friend just 2 weeks ago whose husband was in the hospital, and I called her. She was clearly upset. I was coming from another appointment, and I said, I got you. I'm 10 minutes from the hospital. I walked into the hospital and I introduced myself to her husband, and I said, I have your wife on the phone. I understand you have some issues. Within 24 hours, he was discharged and he was set up for his home treatment. So it just takes having someone on your side to show that they're there and you're not alone.
You know, I love that. I mean, I absolutely love that, because a lot of times, like, we may have something, we don't know what type of doctor to even call. But what age do you think is best to start? Do you think this is more for older folks, meaning parents should advocate for their kids, or really younger folks at any age?
I honestly believe any age. Working with Dr. Stark for all the years that I did, we had a very diverse practice. So not only were we helping the parents as the children started growing up, they came into the practice at age like 15, 16, 17. And, you know, they stayed on through adults and marriage and their kids. So anyone can use an advocate, anyone. It just depends on what you need. It just depends on what you need. And one thing I want to add is, because I do not give medical advice, I am able, though, to work very closely with your primary care's office or with your specialist office. So it's a team approach. It's a team approach. And sometimes it just helps to have that second set of ears.
Absolutely.
You know, because when you're there, you hear one thing, but the doctor may be saying something else. But we process things differently, especially when we're not feeling well, right?
I wish I'd reached out and known about this type of service when my mom was ill. She suffered with ALS, and we went through doctor after doctor, not knowing much about anything, but we had to rely on what they were saying and trying our best to connect the dots. I think we did pretty good, but it would not have been as stressful if we had someone like you to help us to navigate through the entire system.
Yes. And as you know, my father was ill a couple of years ago and passed March 16th of 2023. So he was another reason I think that I was drawn to do this. His diagnosis, you know, with this type of cardiac disease. And when I realized what we were working with, I had to switch from being his daughter to his advocate, right? And being that advocate, I also I know my father, and I had to allow him to keep his dignity and also make his own decisions regarding his health care, but by guiding him, you know. And it was funny because when we would go, I would take him to his appointments at Washington Hospital Center. I swear it feels like we were there every week. And it was almost like, oh boy, here they come again. But the nurses and the doctor made a comment several times that they had never seen anyone with such a great advocate for them. So when he passed, it just kind of felt like, okay, I can do this. And I'm so passionate about what I do. I love what I do. I learned this from working with Dr. Stark and the compassion and empathy that he had for patients. And we just made such a great team. So this is my way of just carrying that on.
And you do it so well. And the one thing that I know about you from years is that you're incredibly resourceful. And, you're just one of those folks that when you put your mind to something, it's going to get done. And so what better advocate to have? So if people wanted to get in touch with you, how do they do that? Do they go onto your website and make an appointment, or is there a number that you want them to call? What is the best way for people to get in touch with you?
The best way to get in touch with me is on my website, which is www.coordinatedcaresolutions with an S, LLC.com. My telephone number is 240-419-6287. And my email is info@coordinatedcaresolutions.com.
Everybody, I introduce you to my friend and now yours, Michele Bell.